The first time I realized something was wrong wasn't when the doctors whispered behind glass or when armed men started appearing in the hallway at night. It was when the man who was supposed to be unconscious reacted to my voice in a way no machine could explain. If you enjoy stories that pull you slowly into danger, loyalty, and impossible choices, go ahead and like and subscribe now. You'll know by the end of this part whether this world is one you want to stay in. I never planned to become important to anyone powerful, let alone dangerous, and when I accepted the overnight nursing assignment in the long-term critical care wing, I thought I was choosing quiet over chaos, the kind of shift where the halls smelled faintly of antiseptic and burnt coffee, where time slowed and nothing truly happened. Room 417 was just another assignment on my chart at first. Male, mid-40s, unidentified trauma patient, 6 months in a coma following a work-related incident, a phrase so vague it felt intentional. He was tall, even lying flat, broad-shouldered, his body marked by scars that didn't match the official story, and his hands, especially his right, were the kind that looked built to command space rather than rest helplessly on white sheets. The first night I cared for him, I noticed the guards outside his door, men who didn't wear hospital badges and never spoke unless spoken to, their eyes always moving, their posture too disciplined for security contractors. I asked a senior nurse once who he was, and she just shook her head and said, "Do your job and go home alive," half joking, half not. So I did my job. I cleaned him, repositioned him, monitored his vitals, and spoke to him the way I spoke to all my long-term patients, because silence felt cruel even when someone couldn't answer. I told him about the rain tapping against the windows, about my double shifts, about how my father used to say people could hear more than we think even when they can't respond. I talked because it made the nights feel less heavy, and because somewhere deep down I believed that being treated like a person mattered, even if the world had written you off as a body kept alive by machines. Over weeks, I noticed things that unsettled me, tiny changes that no chart mentioned. The way his breathing synced subtly when I spoke, the faint tightening of his jaw when voices outside the room grew tense, the almost imperceptible stillness that felt less like emptiness and more like restraint. The guards noticed too. I caught them watching me once through the glass, their expressions unreadable, and after that, they started letting me pass without checking my badge, which somehow made me more nervous, not less. One night, while adjusting his four, I leaned close and murmured something meaningless, complaining about the vending machine stealing my money, and his heart rate spiked, not in panic, but in recognition, like a body responding to a familiar signal. I told myself it was coincidence, fatigue playing tricks on me, but the feeling followed me home, sat with me in my car, and lingered when I tried to sleep. The hospital began to change around him. Administrators made surprise visits. Doctors who had treated him for months were suddenly reassigned. New equipment arrived that no one explained. And still, no one told me who he was. I found out by accident, the way dangerous truths usually reveal themselves, not through confession, but through fear. I was charting outside his room when 2 men in suits stopped near the door, speaking low but urgent, and one of them said a name that made the other go quiet instantly, like the word itself carried weight. I didn't know the name then, not fully, but I knew the tone, respect edged with dread. That night, when I went back in to check his vitals, I felt it clearly for the first time. I wasn't alone with a patient anymore. I was alone with something waiting. The air in the room felt different, charged, like the pause before a storm breaks. I told myself to breathe, to stay professional, and do what I always did. I talked. I told him about a memory from childhood, about sitting in my mother's kitchen listening to stories, about how voices can anchor you when everything else feels lost. And then it happened. Not dramatically, not with alarms or shouting, but with terrifying simplicity. His fingers curled around mine, slow and deliberate, strong enough to stop my breath cold. I remember the warmth of his skin, the undeniable certainty of intention in that grip, and the way every instinct in my body screamed that this moment would change everything. I looked at his face, expecting blankness, but his eyelids fluttered, just once, as if acknowledging me, and in that second I understood that whatever he was, whoever he was, he had been listening all along. I pulled my hand free and stepped back, my heart pounding so loudly I was sure it would trigger the monitors, and when I glanced at the door, the guards were already there, alert in a way that had nothing to do with hospital protocol. They didn't rush to restrain him. They didn't call for help. They watched him, like men waiting for orders. I stood frozen between them and the bed, realizing too late that kindness, in the wrong place, can become a form of involvement. By the end of that shift, room 417 was no longer just a room, and I was no longer just a nurse. I was the one who had spoken to a man everyone else feared to wake, and whether I wanted it or not, I had become part of whatever came next. By the next night, the hospital no longer felt like a place of healing but a controlled zone, and I understood that the man in room 417 hadn't simply woken up. He had reawakened a world that had been holding its breath. I was reassigned twice within an hour, then quietly reassigned back to him without explanation, as if someone higher up had corrected a mistake they couldn't afford. The guards doubled, then tripled, their suits sharper, their weapons no longer hidden, and when I entered the room, every pair of eyes tracked me until the door closed behind me with a sound that felt final. He was awake now, fully, unmistakably, propped slightly upright, dark eyes alert and disturbingly calm for someone who had been unconscious for half a year, his gaze following me with an intensity that made my skin prickle. No machine screamed, no dramatic gasps filled the air. Instead, there was a quiet certainty about him, the kind that comes from men used to controlling rooms without raising their voices. "You came back," he said, his voice low, rough, but steady, as if he'd been practicing the words in silence long before speaking them aloud. I told myself to answer like a professional, to ask how he was feeling, to call the doctor, but none of that came out. Instead, I nodded, because lying felt pointless, and because some part of me knew this moment had been building for months. He washed my face closely, not like a patient searching for reassurance, but like someone measuring honesty, and when I adjusted his blanket, his eyes dropped briefly to my hands before returning to mine, a subtle acknowledgement of the contact that had changed everything. I asked him simple questions, orientation, pain level, awareness, while my heart hammered, and he answered each one correctly, his mind sharp, frighteningly so, and when I reached for the call button to notify the physician, he spoke again, quietly but firmly, telling me to wait. The word wasn't a request. I hesitated, then lowered my hand, aware that somewhere outside the room, powerful people were listening, watching, deciding. "You talk to me," he said, not accusing, not thanking, simply stating a fact, when no one else did. I didn't know how to respond to that, so I told the truth, that it was part of my job, that I hated silence, that I believed people could hear more than we think. His mouth curved slightly, not quite a smile, but something close, and for the first time I saw the scars on his face not as random marks, but as history etched into skin. When the doctor finally arrived with a small army of administrators, the energy in the room shifted instantly. They spoke carefully, deferentially, their relief at his awakening tangled with something that looked a lot like fear, and when one of them referred to him by name, his real name, I felt the floor tilt beneath me. I had heard it before in whispers, in news stories that never gave details, in conversations that stopped when strangers walked by, and hearing it spoken aloud in this sterile room made it terrifyingly real. He didn't correct them, didn't acknowledge it, but when his eyes flicked to me, I knew he was aware that I now understood at least part of what I'd been protecting with my ignorance. After they left, after orders were given and protocols rewritten around his existence, he told me I should go home early, his tone almost considerate, and that was when I realized how carefully this man chose every word. I said I'd stay until my shift ended, because leaving felt like abandonment, and because some instinct told me that whatever came next would be safer if I was present. Over the next hours, men came and went, some in suits, some in scrubs, all deferring to him in subtle ways, and I watched as information flowed toward his bed like tributaries to a river, decisions made quietly but decisively, his empire reassembling itself around a heartbeat that had never truly stopped. He asked me questions too, not probing, not invasive, but precise, where I grew up, how long I'd been nursing, why I worked nights, and I answered, aware that each truth was a thread tying me closer to him. At one point, voices rose outside the door, sharp with tension, and I felt fear coil in my stomach, but he merely turned his head slightly and spoke a single name, his voice carrying just enough authority to snap the sound away into silence. That was when it hit me fully. This wasn't just a powerful man recovering. This was a balance shifting, and I was standing too close to the center. Near dawn, as the city outside the windows began to lighten, he looked at me and said something that settled heavy in my chest. That people had tried very hard to make sure he never woke up, and that the fact he did meant mistakes had been made. He didn't say it with anger. He said it with calm certainty, like someone discussing weather patterns rather than betrayal. And you, he added, his gaze steady, are now part of the reason I'm still here. I wanted to argue, to deflect, to insist I was just a nurse doing her job, but the words wouldn't form because deep down I knew he was right, and that frightened me more than anything else that night. When my shift finally ended, one of the guards walked me to my car without being asked, standing watch until I drove away, and I realized then that protection, in his world, wasn't optional. It was imposed. As I lay awake hours later, exhaustion buzzing through me, I understood that part 2 of this story wasn't about his awakening at all. It was about the moment my life quietly diverged from the path I thought I was on, pulled into the orbit of a man whose gratitude could be as dangerous as his wrath, and that whatever came next would demand a choice I wasn't sure I was ready to make. By the time I understood there would be no clean way out of his world, it was already rearranging itself around me with unsettling efficiency, smoothing edges, closing doors, and offering comforts that felt less like kindness and more like quiet negotiation. He recovered quickly, too quickly for a man who had spent months suspended between life and death, and within days the hospital became a formality rather than a refuge, its rules bending to accommodate his presence until he finally left under the cover of night, escorted by men who treated the city like territory rather than home. I expected my role to end there, to fade back into anonymity once he was gone, but that was a misunderstanding born of how normal life works, not how his does. The first sign was the apartment. My rent paid 6 months in advance by a private donor. The landlord suddenly eager to fix things he'd ignored for years. The broken lock replaced with one far more secure than I'd asked for. The second was the job offer that arrived without an interview. A prestigious position I wasn't qualified for on paper, but somehow perfect on every other level. When I confronted him, because yes, I did, calling the number I'd been told was for emergencies only, he listened without interrupting, then told me calmly that none of it was a gift. It was compensation. I had given him something irreplaceable when no one else thought he was worth listening to, and in his world, debts were not abstract concepts. They were obligations carved into memory. I told him I didn't want to owe him anything, and he surprised me by agreeing, saying that owing him would be dangerous, but being protected by him was not the same thing. Protection, he explained, was simply the natural consequence of proximity, and I had crossed that line the moment I treated him like a human being instead of a rumor. The city began to feel different after that, less random, as if invisible hands were quietly redirecting potential threats away from my path. And while nothing overtly bad happened, I became acutely aware of how often it could have. One evening, months later, I saw him again in person, standing across a crowded room at a charity event I hadn't known he would attend, his presence warping the atmosphere the way gravity bends light. We didn't speak, didn't even acknowledge each other, but when our eyes met, I understood the unspoken agreement between us. My life would remain my own as long as I didn't try to pretend his influence had never touched it. I realized then that what he had done after waking up wasn't dramatic or cruel or even heroic. It was calculated restraint. He hadn't pulled me deeper into his world, but he hadn't let me walk away unchanged either, because people like him don't believe in untouched outcomes. And in the quiet months that followed, as my life stabilized in ways I never expected, I came to terms with the truth that still sits with me now, that sometimes the most dangerous thing a powerful person can do is decide you matter, and that my story didn't end the night he opened his eyes. It simply became something I would carry, like a scar you learn to live with, invisible to everyone else, but impossible to forget.